how to know what's really working for your kid, how to know what visual exercises are really working for your kids. And guess what? That means doing your exercises on yourself. And if you're doing your exercises on yourself and you're like, that's not working for me, like, it's not working for your child. Your child can't communicate to you like, that's not working for me, because they don't have anything to compare as far as good vision, bad vision. Like, they just have vision and it's the same for them. But you can compare, and more so if you're also visually impaired. And so for me, I can go through the vision exercises, take off my glasses, and like pretty much I can't see the lines in the black anymore from my printer dying, and I just see red. Like I can barely even see the definition of these images, and I see them more so because I know what I'm looking at. But I mean, it's barely. And so that dragon fruit, it does look appealing. What does that look like with my glasses? It's interesting. So I'll work with that. I don't know why that's just so visual. I mean, I do know why it's so visually appealing, but even just being impaired, like, that's really appealing. And so even with yourself, you want to work with your eyes. And so my baby's waking up. Hold on just a second. This is me at home working with my kids, so I keep stuff like that in there because, like, I just have too many experiences where parents are like, I don't know how to do that at home. Like, I just close the door so it's a little bit quieter, give me a few seconds to just work. And she's just waking up, so she'll just play in her crib for a minute. So when you're working with your children and you're doing the visual exercises, do them on yourself. And I was trying to do this so you could see my eyes, but you may not be able to because it's gonna go in front of my eyes. Maybe if I come here to the side and bring you up a little bit. So I'm going to be looking at my object, but you're just going to watch my eyes track a little bit more. So I can just tell you specifically what I'm feeling as I'm working through this exercise. So the thing is that you want to be sitting straight and you want to catch your eye. And I want to be right here through the center of my eyes. That's where I want to catch the vision at first, if I can, with your child. And with you, if you have more mature vision, you're just going to look with your eyes versus looking with your head. More than likely, your child's going to have to look with their entire head. And you can pretend to move like your child, so why don't we do that first? And we're just going to bring the object across. Oh, that's too fast. Now I'm going to come back, take the object away, catch the vision. And do that. So something I noticed for me, I was really moving my chest with that. I don't necessarily want the head and the chest to move together. That's not necessarily a good thing. That's just showing a movement impairment of you're not being able to separate the head from the chest. And so you're going to want to work on that movement wise, even though we are focused on vision, like that's a sign of poor just movement development. And so that's something that you'll want to work on. I can do a short exercise to show you how to work with that. But so trying that again. So I'm going to look, and now I'm just going to try and move my head and follow the object instead of moving my shoulders with it. My shoulders can go a little bit, but I shouldn't be like looking with my chest. Does that make sense? And that was a little more smooth, like it was awkward looking with my chest. Sorry, you're not getting to see like my eyes completely, but okay, that's all right. Now, if you're having somebody who has more mature vision, okay, and they're looking forward and they can just come over here and look with their eyes, okay, that's a sign of more mature vision, which I would be surprised if your child with cortical visual impairment has that. Probably don't, but just in case you have a very advanced CVI child. Oops, I'm not supposed to look with my head. So that's even for me, like I probably need to work with that visually a little bit, because I'm having to look more with my head to my left versus than what I am to my right. And so that's just probably just left eye or right eye weakness. Sorry, I have to look more to my right versus I can just look to my left. And so that's just a right eye weakness. And that's where I can just work with the individual eye and just, start here at center and work with the eye and come across and come across. Now you don't necessarily want to go clear over here. I'm just trying to like show you a visual. You really just want to go to like 45-degree angle. Okay. You can go a little bit further if you're working with your child's peripheral. If they don't have the peripheral, that can be a little bit more difficult. But then too, taking your object and now just going through the center. Well, let's focus here. You're going to go through the center, but we're going to see how both eyes are working. Can I focus and converge on that object with both eyes? And if your child is just continually looking away, when you're trying to do both eyes, like your intent is to work with both eyes, they probably don't have convergence. And so it would be worth seeing if they need glasses, if they have different scripts in each eye, if they're farsighted, nearsighted, if they have an astigmatism, things like that. Your doctor will be like, oh, kids will just grow out of that. Like, it's okay. Okay, if your child is typical, like, you can, like, that child can work with the visual impairment. Okay, your child is not typical. And so the fact that there are visual needs for glasses, things like that, like, you get the glasses. Don't be like, oh, they'll grow out of it. Like, no, like, this is a compromised system. You don't want vision on top of that, because it just makes it more compromised, and just makes development harder. So that's just something to look at. So if they can't do that, that's something to look at. So now what you're going to do is you're just going to focus on each eye individually, and you're just going to watch how it moves. So even though they may have both eyes looking, stuff like that, I know with CVI you look at something and you turn away. So it's a lot slower. So more like if they're looking at something and they turn away, mimic their movements, like see where you're losing their vision, and you go try and mimic that and see what you're feeling like. And that can give you so much guidance on how to work with your child, because you might be like feeling a strain in another part of your body. You might be if you sit where they sit and do different things, and you find that you get to this one point and they keep looking away, like, is it the image, or is something else distracting them? That, like, once you get to this point, like, say next to my black thing, that in the background there was a brighter color thing. I don't know, like something that was different enough in my background that I was getting distracted with that. And two, like, I'm not working with CVI kids because I want you to see visually, like, what you're looking for when you're going through these exercises, what you're doing. And so when you're working with your kids, you probably have to go a lot slower. And so, like, if you're starting here at the top and they look away, okay, wait till they come back, and then you come down a little bit more until they look away and they need to process what they're looking at, and then they can come back. Like, that's part of the processing, is I've got to look away to try and figure out what I'm looking at. But we're also going and working with color, so that's why we want the natural we're working with natural reds right now, because we want it to be, we want it to attract the eye and to be comfortable to the eye, to the natural instincts of the eye and things like that. And for whatever reason, this dragon fruit, like, it really just is really appealing. I don't know if it's the seeds or what, but I like that. Just being like looking at it visually impaired with my glasses, I'm like, well, it looks fine at it, but without my glasses, I'm like, oh yeah, that's really nice. It's just easy to look at. So when you're working with your child and they're struggling, you just go to where they stop looking and just leave the object there. Don't try to chase their vision, because they're trying to process and trying to learn focus, things like that. And so you just wait and let them come back. And sometimes you just have to keep it there and until you can get them to look, and that's okay too. So a couple things that you might want to work with is, depending on where they're at visually, if you're starting up here and they just can't stay focused, you may just need to come down a little bit more, and you want to be finding their range of just visual comfort, things like that, and their different abilities. So those are just things to make note of. I am going a little bit off of Michelle's diamond scale visual assessment as far as these visual midlines that I'm going through. We're working on functional vision, stuff like that, like functional vision that should have been coordinating with your child's milestones. And so we're giving them that experience as if they were setting up with their physical milestones. But like I was saying, I was looking with my chest. Okay, like even the physical milestones are not setting up. But my child's yelling, so that's not going to be great on the video. So I'm going to be done with that. But try your exercises on yourself, no matter what you're using, what objects, things like that you're using. And it will give you more insights on how to work more successfully with your child. Like and subscribe to the channel so you can learn how to work with color and visual processing for your child, and really start at the beginning of visual development, and start teaching them that process. Like I'm focusing on the color part, like just even the very initial first weeks of life, our first months of life, where that color is really being established. Like if the color part doesn't set up, like it just makes everything else harder visually to set up and movement wise to set up. And so we're really working with the color aspect, using specific colors, using I'm using specifically an 8x8 square. Now if you get the book, it will have a white border, so it's okay if it's a little bit smaller, but you don't want to cut it down much more than the white border around the page. Okay, you can print them off as 8x8s, but whether you're using your own pictures or my pictures, those are just things that you want to be aware of. And you can use lights, but you want to graduate from lights, because lights is like the super beginning of vision. It goes lights, black and white, color, and we're not working with black and white yet, just because it's we are working with black. The white one is just a hard one to process, and so we're just working on some easier colors. There is a little bit of white in these things, but we're just not working with black and white directly, and we'll work with that a little bit more and integrate them with the colors instead of it just being solely like black and white. We want to help the eyes transition from light to black and white to color, and not just like get stuck in the light and black and white phase. Thanks.